As the largest lighting manufacturer in the world, but some of you may not be aware, it actually has a separately run medical branch, which is Philips Healthcare. To say it is an exciting space or an industry for a tech giant to be in would be an understatement, with the healthcare industry experiencing a rapid pace of innovation, from robot nurses to machine learning apps to cutting-edge equipment. To talk to us about how technology is sweeping across the whole spectrum from hospitals to insurance players, Philips country manager Ashwin Chari now joins us live here in our Rockwell studio. Good morning, Ashwin. Thank you for joining us.
Thank you. Good morning.
So just to clarify it for our audience as well, Philips Healthcare is a different entity completely from the Philips lighting.
Yes, that's right. So Philips, as you know, has been around for 125 years. We've gone through several phases of transformation, but this is the biggest transformation that we've ever done, because Philips started off as a lighting company. And then 3-4 years back, we decided that we're going to become a health-focused company. So we've done that transformation, and now Philips is solely focused on health and wellness.
And why? Why the health space?
That's a very interesting question. I think the way we see it, if you look at the trends that we see in the world, right? We're seeing growing population, we're seeing an aging population, and this is leading to chronic diseases and a lot of healthcare spend. So we believe that this is the industry to be in. This is the industry where there's a lot of innovation. And if you look at the vision of Philips, it is to make the world a more sustainable place, right? And so we see that this is with the industry growth, with the attractiveness of the industry and the proximity to the Philips vision, this is the industry to be in.
Okay, before we go to the Philippine setup, I know that you guys are coming up with some very interesting innovations in the healthcare space. Let's talk about one that you just launched, which is supposed to replace the box that we all are so familiar with when we get ultrasound.
That's right. It's not entirely replacing the box, because the ultrasound still has applications in, the traditional ultrasound still has applications in hospital. But just to build on the trends that I was talking about, we are seeing an increasing need for healthcare to be closer to the patient. And as part of that move, we have just launched our game-changing, revolutionary technology. We call it the stethoscope of the future. This is a palm-sized ultrasound. This is actually an app that you can download from the Android store, and it works with a transducer. So this transducer is handheld, and that's your ultrasound. So this kind of completely opens a new domain for us. This is point of care, but this is designed by clinicians, for clinicians. So you can look at the applications, and they are like countless. So you can talk about ambulance, where you need to make split-second decisions, life or death decisions. You can talk about ICU applications where you can't move the patient. So, and sometimes you don't have access to a full-fledged ultrasound. You can talk about emergency medicine, where you're in the most remote areas and you suddenly need to diagnose. You can talk about sports medicine. So this is an interesting application where, usually you don't have sonologists in sports medicine. So the kind of scope for this point-of-care technology is endless.
But this, just to clarify, this is not for retail. This is not for me, for example, to download.
Unfortunately, no. It's not for consumers. But what we are doing increasingly is, if regulation allows, you can have health tech workers, healthcare workers like midwives using this. And we see this in countries like Indonesia, where in the most remote areas, we have an application called MOM, which is Mobile Obstetrics Monitoring. It's another app, an Android app, which allows midwives to translate, to measure if certain pregnancies are high risk or not. So they take some vitals and then they transmit it back to the doctors who are in the urban areas, and they're able to figure out whether the pregnancies are high risk or not. And the next stage of that would be an immediate intervention, where the pregnant woman goes to a center where she can be scanned with the Lumify, our handheld ultrasound. So you're actually taking healthcare to the most remote settings, and you're giving midwives and healthcare workers access. So they are able to do the scans, and it gets remotely transmitted to doctors who can read.
So when you download the app, it's for free?
Yes.
It's for free. Do you need to train the person who's going to be using the app?
because it's an ultrasound. You're training the person to use an ultrasound, but it's no different from people who are already using the ultrasound. For example, nurses and midwives, they are sometimes trained to use the ultrasound, and it's pretty easy for them to use this new Lumify ultrasound.
Aside from improving accessibility to healthcare, especially in far-flung areas where we don't have the technical people to do it, for example, what about costs? What are the cost benefits?
Yeah, so the interesting thing about this is a completely new segment, right? So you have very high cost products in hospitals, and then you have entry-level products. This is closer to the entry-level products because this doesn't give you the full portfolio that you would have in hospital, but it does its job. It gives you what is needed in these different settings. If you're talking about emergency medicine, if you're talking about ambulance, sports medicine, it gives you what you need. Plus, it uses the same technology that we've been developing for the last 20 years in terms of resolution, in terms of ergonomics, in terms of durability. It gives you more than what is needed.
So this equipment that you just rolled out, Lumify, for example, it's not meant to replace the ultrasound. It's supposed to be the initial check.
Exactly. And in areas where you don't have access to ultrasound, as I was mentioning, ambulance, emergency care, you sometimes cannot carry that full box. Imagine you'll have to charge it somewhere. Right here you are in the most rugged settings, most rural settings, and we've heard from doctors that they're able to run this for 6-7 hours without a charge.
Wow.
So you don't even need electricity. Yeah.
You just need your phone.
You just need your phone.
And you see exactly what you're supposed to see in that box.
You're only limited by the resolution of the phone or the tablet.
You earlier mentioned this is going to be cheaper, a lot cheaper, a fifth.
Sometimes, yes, depending on what you're comparing it with. Right, because this is, if you compare it to the most high-end ultrasound, you'll definitely see a factor of that.
What about a standard ultrasound?
I think so. I think you will see a factor of 3, factor of 5 sometimes.
3, factor of 5. Okay, let's talk about the reception so far. What sort of interest are you getting?
So we've had...
From the big hospitals, from the provincial hospitals?
So we've had this in the hands of several key opinion leaders, and interestingly, during our launch 2 days back, we had a cardiologist, we had a sports medicine doctor, OB/GYN. They were sharing their stories, and it was really, really interesting for us, for the audience, to listen to them, to see how they're using how they're using the ultrasound. And each one of them had a different story.
Is this app for the Philippines only, or it's for...
It's the same app worldwide.
Worldwide. If the app is free, how is Philips going to monetize on it?
Because you have to pay for the transducer. So it's ultimately a package. It doesn't work by itself. The transducer is the ultrasound, right? It's really the handheld ultrasound. It works with the app. And of course, we don't want consumers to download this, but it's for healthcare practitioners.
So it has to be a specific transducer.
Yeah.
It can't be just any other transducer.
No, it can't. It's the Lumify transducer.
Okay. And how, if you look at the Philippine healthcare landscape, how do we compare? How do we stack up against your Asian neighbors?
Yeah.
Would you say we're advanced, or just in line, or behind?
I think there are several factors that are working in favor of Philippines. If I look around Southeast Asia, what I see is a lack of talent for healthcare. However, in Philippines, you're a net exporter of talent. You find a lot of Filipino doctors and nurses overseas, so this seems to be a big generator of healthcare. So that's really good for the Philippines. There are certain trends which are similar to what you see in the rest of the world. You have a growing population, you have an aging population, you have sort of rising income levels, which is leading to change in lifestyle, and hence maybe the increase in chronic diseases, which is unfortunate, but it's the truth. This is leading to pressure on the healthcare system. So I read somewhere that Philippines needs about 40,000-50,000 beds. That unfortunately is only going to increase because you're going to have growing population, aging population, chronic diseases. So I think the way to address that is really about looking towards innovation, bringing healthcare closer to the patient, and doing things outside of the hospital. So we believe in the continuum of health. So starting from healthy living to prevention, diagnostics, treatment, and home care. I think a lot more needs to be done in the healthy living and prevention, because otherwise you're ending up spending a lot of money on hospitals and sick care.
This is actually a very interesting event, because in the Philippines there's a statistic that tells us that 6 out of 10 Filipinos actually die without even seeing a doctor.
That's really sad, but that's unfortunately the truth.
So let's talk about Philips here in the Philippines. You don't manufacture anything here. Is that correct?
No, we don't manufacture anything here. We manufacture We don't manufacture
Not
healthcare
yet?
equipment. Not yet, perhaps.
Is that in the cards?
No, I can't talk about that right now. But what we can say is that we've increasingly focused on emerging markets. Philips has innovation which is built for emerging markets. So the emerging market view is always taken into account when we are building new products. So if you are launching products here, there's always feedback loops from the market, and eventually there are solutions built for the Philippines.
So you primarily see Southeast Asia as a market and not as part of a supply chain of sorts, a production house.
I think ultimately it's about bringing solutions that are necessary for the market, and we get that done through a very strong feedback loop from the market.
How big is your workforce here in the Philippines?
We have different types of businesses here. So we have healthcare, we have consumer, we have even back-end operations for our global business services. So put together we have over 100 people here.
And do you see that number growing? If so, what is the target over what time horizon?
So it's a bit difficult to predict. I think we see this as a very important market for us. We see this as a growth market, so I think our growth will be in line with the growth in the healthcare industry.
Okay, on that note, thank you very much, Ajahn, for joining us, and good luck. Hopefully, you'll really succeed in bringing healthcare closer to the people.
Thank you very much.
Thank you. Now, coming right up.